Hello, everyone. Welcome to another topic in pharmacology, which is medication errors and how to avoid them. Okay, so this is still part of our midterm module in NCM 18106. Okay, so let's start. Now, as we know, the drug regimen process, which includes the prescribing, the dispensing, the administering a drug to a patient, has a series of checks along the way to help to catch errors before they occur. So these include the physician or the nurse practitioner who prescribed the drug, the pharmacist who dispenses the drug, and the nurse who administers the drug. And each serves as a check within the system to catch the errors. The wrong drug, the wrong patient, the wrong dose, the wrong route, or the wrong time. So often, the nurse is the final check in the process because the nurse is the one who administers the drug and is the one responsible for patient education before the patient is discharged to home. So, nurse's role in medication error, the monumental task of ensuring medication safety with all the potential problems that could confront the patient can be best managed by consistently using the rights, okay, of medication administration. So later on, we will also discuss the different rights of medication administration. In medication administration, ang nurse daghan siyang mga responsibilities na kinahanglan ning buhaton. Okay, part of the responsibility is dapat the nurse is responsible for safe and accurate administration of any drugs. Okay, of any drugs. So in order for us or in order for nurses to provide safe and accurate administration of the drug, dapat mahibalo siya unsay components sa drug, unsa ang mga side effects, unsay dapat patient education ang ihatag ngadto sa iyang patient. Next, the nurse is responsible for having sufficient drug knowledge to recognize and question erroneous errors. That's why nurses need to know the different kinds of drugs para asa siya. Okay, what is the indication or what are the indications of the drug that is to be taken sa patient? Next is we have the actions delegated to other persons. Okay, in this statement, our nursing attendant, okay, they are the ones who will assist the nurse, but they are or they cannot give medications. Okay, nursing attendants or the orderly or other healthcare providers cannot administer the drug except for the doctor, pero seldom ra kaayo na nga ang doktor maghatag sa drug. Most likely ang nurses gyud ang mag-administer sa mga medication. So dapat careful ta when delegating, or as much as possible do not delegate. Okay, do not delegate in giving medications to your patients. Dapat kung ikaw ang nag-prepare, dapat ikaw pod ang mag-administer sa drug sa imong patient. Another responsibility is to monitor client's response to a medication. Okay? So, in order for us to monitor the client's response to a medication, dapat ang mahibaw sa baseline data ni patient prior to giving the medication. Okay? And check whether there are side effects or adverse effects nga hitabo sa patients. And lastly, the nurse is also responsible for following the safe practices. That's why nahimo or na-formulate ang 12 rights of medication administration. Okay, so let us define the adverse drug reaction and an adverse event. Now, both drugs or both terms, they have this common keyword nga adverse. Okay, so the adverse. So when we say adverse, that is unintended or kanang wala siya gituyo. Okay, it's an untoward. Okay, pwedeng event, pwedeng a reaction. Okay, and sometimes it may cause possible um possible and harmful effects. Okay, sa tao or sa patient. Now, your adverse drug or your adverse event is any untoward medical occurrence that may present during the treatment with a pharmaceutical product, but which does not necessarily have a causal relationship with this treatment. Okay? Pwedeng naay nahitabo, okay? Naay nahitabo ni patient, pero dili siya related. Pwedeng related or pwedeng dili siya related sa tambal nga gitake niya. Okay? So, in adverse drug reaction, it is innoxious change, okay? So, harmful change, which is suspected to be due to a drug, uh, and of course, at doses normally used in man, and kinahanglan na siya, or it is required to have a treatment or decrease in dosage, or indicates a caution in the future use of the same drug. So, makaingon ta nga ang drug reaction is an adverse event with a causal link to a drug. So, by definitions, all ADRs, okay? All ADRs, tanan nga mga adverse drug reactions, they are also adverse drug events. Pero, dili tanang adverse drug events kay mga ADRs. Okay, kay ngano, as mentioned earlier, pwedeng naa siya'y, pwede nga, naay nahitabo or medical occurrence nga nahitabo, pwedeng related sa drug nga iyang gitake or pwede pod nga dili tungod sa drug nga iyang gitake. Okay? Now, there are two types of ADRs. We have the allergic reactions and the idiosyncratic reactions. These allergic reactions, example niya, hypersensitivity to the drug, nag-Stevens-Johnson syndrome, namula ang patient, nanghupong ang patient, those are allergic reactions. For the idiosyncratic reactions, these are reactions nga dili nimo siya gituhuan nga or lahi siya nga effect, okay, other than allergic reactions nga mahitabo sa patients. Okay? Now, for other definitions, you have here a side effect. So, ang side effect, kalahian niya sa side effect is ang imuhang your adverse effect is unintended. Okay? Unintended effect. Okay? Ang side effect is known siya nga effect, okay, other than the primary intention or ang primary therapeutic sa drug. Okay? So, relating to pharmacological properties of a medication. Okay? For example, given na nga ang isa ka effect kung mag-take ka og opiates or the opiate analgesia kanang taas-taas nga form sa painkillers or analgesics is makakos siya og kanang kasukaon ka. Okay? Pero known na siya. Mo ang gitawag nga side effect. Pero if unintended siya nga mahitabo, wala ka nagtuo nga mahitabo siya, that is an adverse reaction or an adverse effect. So, again, as defined, your adverse reaction is the unexpected effect or unexpected harm arising from a justified action where the correct process was followed for the context in which the event occurred. So, even though sakto ang imuhang pag-administer o pag-prepare sa drug, but there is still an adverse reaction or there is still an unexpected reaction, that is an adverse reaction. Okay? So, for the error or medication error, it is, or any types of error that means a failure to carry out a planned action as intended. Okay? So, wala nimo na carry out pagtarong ang intended or ang planned action. Okay? Pwede nasayop ka. Okay? Nasayop along the way sa pag-prepare, sa pag-administer, sa paghatag. Okay? So, that's it for the definition. Ang adverse drug event, okay, this is mananani siya. It may be preventable, okay, or not preventable, okay. So, a medication error may result in an adverse event if the patient is harmed or near miss, if a patient is nearly harmed or neither harm or potential or harm medications error are preventable. Okay, so we define here the different types of medication errors. So a medication error is any preventable event. Okay, take note, it is a preventable event that may cause, okay, pwedeng hinungdan or pwedeng will lead to inappropriate medication use or the patient harm while the medication is in the control, okay, in the control of a healthcare professional. Okay, so when we say the medication is still in the control of a healthcare professional, pwede ang error nga hitabo is during the prescribing, okay, prescribing phase the doctor, pwede po sa dispensing phase or sa dispensing part done by the pharmacist or during the preparation and the administration part done by the nurse, okay? So that is considered a medical error, okay? Or pwede po siya naa ni patient, for example, wala na tarong pagsabot ni patient kung unsaon pag-take ang tambal, okay? And the patient is still under the control of the healthcare professional. So that is still a medication error, okay? Such events may be related to professional practice, okay? Since your medication error is under the control of a healthcare professional, so pwedeng si nurse, pwedeng si doctor, pwedeng si pharmacist ang ang sakop ani niya nga mga medication errors. Okay? That's why kung naaman gani, for example, nareklamo ang pasyente nga naa siya'y nabati and then moreklamo siya sa hospital, so ang manubag is the nurse who administers the medication, the pharmacist who dispense the medication, and the doctor who prescribe the medication. Okay? All under the scope of their professional practice. Now, pwede pod ang mga medication error tungod sa healthcare products, okay, nga iyahang gitake, okay, or sa product mismo ang problema. Okay? Pwede pod sa procedures and the systems. Okay? When we say procedures and systems, procedures include the administration, the dispensing, pag-prepare sa tambal, pag-prescribe sa tambal, or ang pag-ship sa mga tambal, the storing, okay? The storing of the medications, kung insakto ba. Pwede pod na ay medication error because of an incorrect product labeling, okay? Nasayop og label or nasayop og package and then nasayop og tanan, nasayop og name ang tambal tanan. So, muna siya nga mga event nga pwede tang makaingon nga isa siya ka medication error. Okay? Now, take note that medication errors are preventable. Okay? So, pwede siyang ma-prevent. Okay? Kung sakto lang, kung gi-follow ninyo pagtarong ang hospital protocol, okay, kung aware ka sa imuhang ginabuhat o ginabuhat sa doctor or sa pharmacist or ikaw nga nurse, kung insakto, ma-prevent ang mga medication error. And it is considered as a common cause of adverse healthcare outcomes. Okay? So, unsay nahitabo, okay, unsay nahitabo sa patient while taking the medication, okay, pwede na ito makonsider, siya nga medication error. So, effects can range from no significant effect, okay, or pwedeng makakause ng disability, okay, or even death, okay, ang mga medication errors. Okay, we have here examples of common classes of medications involved in serious errors. Okay, so we have the antibiotics. Now, there are some patients nga allergic to some kinds of antibiotics. So, that's why kinahanglan ta mag-assess whether allergic ba si patient or dili. So, if ever man gani na ay allergy si patient sa mga antibiotics, ma-prevent na to ang hypersensitivity reaction. Okay? Ang pinakagrabe nga hypersensitivity reaction is your Steven-Johnson syndrome. Okay? Isa siya ka severe kay adverse effect wherein ang skin ni patient is mura siyag masunog because of taking a kind of medication, possibly antibiotic nga iyang i-take. So, mura siyag masunog, malanay, mga tangtang ang part sa iyang skin. Okay? So, it can lead to death. Okay? Now, there are also anticoagulants that is involved in serious errors. Kay natay mga anticoagulants nga kung masubraan ra kaayo, okay, it may pose a risk to the patient. We also have anti-diabetic agents, particularly insulin, kay nga no, if you take or if you inject um, or nag-overdose ka og insulin, okay, need kita hay dili insakto ang pag-compute sa pila dapat nga insulin nga ihatag ngadto sa patient. Okay? Ang purpose man gud ganong maghatag ta ni insulin is to lower down the sugar level of the patient. Okay? So pangpaubos man siya. So pangpaubos man siya sa blood sugar ni patient. Now kung masupraan siya og hatag ang insulin, pwede na pod nga maka-cause og hypoglycemia, okay, ni patient. So imbis nga i-treat nato si patient, okay, para makalungtad siya sa isa ka adlaw nga paghatag sa insulin, makakos na noon ta sa iyaha og harm kung mag-overdose ta sa insulin nga dapat ihatag or pila ka units dapat nga ihatag ni patient. Okay? For anti-neoplastic, anti-cancer agents, now these medications, these are immunosuppressants. Now kung sobraan kaayo kaisog ang mga anti-neoplastic agents or anti-cancer agents nga ihatag sa cancer patients, pwede nga mas mubaba pag-ayo ang iyang immune system. Okay? Known na siya daan nga immunosuppressant. Ipaubos niya ang immune system. So kung ipaubos pa niya daan ang iyang immune system, most likely si patient makakuha siya og kanang secondary infections or secondary nga mga sakit because of the overdosage of these anti-neoplastic agents. Okay? Also, the cardiovascular agents, dapat careful ta sa dosage nga ihatag nato sa cardiovascular agents kay this can lead nga mag-compensate si heart o mag-overcompensate siya. Okay? Dili na noon siya ka-perform og tarong. Okay? And we also have CNS active agents like the opiates and anesthetics. Okay? So, ang buhato ni opiate or ni anesthetic kay aside sa i-decrease nila ang pain, nga wala na yung mabati si patient, pwede nga makasedate og ayo. Now, when you are overly sedated, okay, pwedeng mamatay ang patient. Okay? And also the vaccines. The vaccines is dapat nato siya i-consider because nate gitawag nga mga reactions after injecting with vaccines the patient. So, there are cases that is kanang namatay ang bata because of the vaccine nga gihatag naa di ay underlying condition ang bata niya wala na assess niya nahatagan og vaccine or for example ang bata is nagilanat na siya daan niya gihatagan og certain type of vaccine nga makahilanat makasuppress pa sa iyang immune system. So, mo nang involve si vaccine sa isa sa mga serious errors in administering any medication. Now, let us talk about those patients who are at most risk of medication error. So, kani siya nga list, gamay lang niya siya, but these are the common ones. Okay? Let's start with the patient on multiple medications. Now, there are some patients nga daghan o ginatake ang mga tambal. Daghan sila gitake, for example, na sila tambal para sa ilahang high blood, at the same time, napad sila tambal para sa ilahang diabetes, and they also have medications to lower down their cholesterol level, or pwede po na sila tambal nga para sa ilahang arthritis. So, daghan nga mga medications, most likely maglibog sila if they don't have a regular schedule of taking those medications. So, we also have those patients with another condition, okay? Comorbid conditions. For example, if your patient has renal impairment, okay, daot na ang iyang kidneys, or for those patients nga daot na ilang liver, okay? So, if natay mga inana ang klase ng mga patient, and the doctor prescribing the medication, wala siya nakabalo, bahin ana nga condition sa patient, most likely, the doctor would prescribe a medication for regular patients, okay? Or for regular patients nga walay underlying nga mga conditions. Okay? Pwede pod nga mga pregnant patients. So, when you are pregnant, dili ka basta-basta makatake og any medication. You have to consult your doctor. You have to consult your obstetrician on what medications you can take during pregnancy. Okay? Because there are medications that are teratogenic, meaning pwede siyang makapatangtang sa bata. Okay? We also have those patients who cannot communicate well. By those patients nga dili maka-communicate well, pwedeng dili lang siya makaistorya, pwede pod nga dili sila makadungog pag-ayo. Okay? So, if they cannot hear well, okay, dili nila masabtan, or dili na dali masabtan kung unsa tong gi-endorse sa ilaha, or gi-advise sa doctor sa ilaha. Or napoy mga patients nga even though naa sila history of drug allergies, dili sila maka-communicate kaayo pag-ayo kay tungod nalimot sila, or dili lang sila kabalo mo explain sa ilahang doctor, the one prescribing the new medication, dili to siya ma-take into consideration sa doctor nga mag-prescribe og new nga tambal. There are also those patients that who have more than one doctor, okay? So, ang tawag ani niya is polypharmacy, okay? Pwede lahi-lahi iyang doktor, depende sa symptom, or depende sa iyahang sakit kintahay. For example, naa siya sakit nga related sa iyahang musculoskeletal system, lahi nga doctor yang i-consult. If naapod siya problema sa iyahang respiratory system, lahi po moadto pod siya sa isa ka internist or sa pulmonologist. If naapod siya sakit or condition sa heart, okay, moadto pod siya og isa ka cardiologist. So, that patient, okay, daghan siya mga gipang konsultaan nga mga doctor. Okay? Pwede man god na ang isuggest sa doctor nga medication, or prescribe sa doctor nga medication ana nga patient, same ra sa katong gi-prescribe sa doctor ana nga medication. Okay? So, if that happens, now, mag-ingon kadaan sa imuhang doctor konsultaan nga what medications you've been taking, or ang nagireseta sa imuha by another doctor. We also have those patients who cannot take an active role in their own medication use. For example, ani niya kanang mga older patients, okay? The elder patients. Okay, so sometimes they need someone who will inform them, or every day or daily nga mag-inform sa ilahang dapat i-take ni nga medication, kani ang imong scheduled medication for today. And then there are those patients nga dili sila mentally capable of taking their own medications. Okay? In the case of children and babies, okay, mo nang kinahanglan og exact nga dose calculations, kay lahi ang dose nga i-require sa adult, lahi pod ang dose i-required para sa mga children and babies. So earlier we discussed about patients who are most likely at the risk of medication errors. Now this time we will be talking about the staff or the healthcare providers, and in what or situations or conditions these healthcare providers or staff most likely to contribute to a medication error. The first one is the inexperience. So we consider this one as kinsa man tong mga staff or kinsa man tong mga healthcare providers nga makaingon tag na ay inexperience, okay, or less experience lang when it comes to medication administration. Okay, one example of that is a student. Okay, a student nurses or student doctor or student pharmacist. Okay, so when you have less experience, okay, most likely naagid na yung mga instances nga magkasayop-sayop ta. Okay, because we do not know, wala ta kabalo unsay buhaton. Okay, wala ta kabalo para unsa ni siya. Okay, unsay next nga buhaton after administering the medication, or para asa na siya nga medication. Okay, so that is an example of an experience. Na ikaduha is ang kanang kung magdali-dali ta, rushing. Okay, so kung magdali ta, we cannot properly perform medication administration, or in sa case po sa pharmacies, kung magdali sila, pwedeng mga sayop sila in dispensing the medication, or ang doctor pwede po siyang masayop in medication administration kung magdali-dali. Okay? And we also have doing two things at once. Okay? Nakakailaing gibuhat aside from preparing your medication, from administering your medication. So, instead nga ang imong focus na sa hatag sa medication, okay? Tungod kay nakakailaing gibuhat, most likely it will contribute to a medication error. We also have interruptions. Okay, interruptions. Kintahay, nag-prepare kang medication. Okay, ikaw nurse, nag-prepare kang medications. You are assigned as a medication nurse. Unya, gitawag ka sa imong kauban nurse to help you with something sa ward ba kaha or sa inyong station. So, kato siya nga mga interruption, pwede nga while preparing the medication, imbis nga nag-compute na ka sa insaktong dose nga i-prepare para sa patient, tungod kay nawala ka because of that interruption, it will contribute or it might contribute to a medication error. Next, we have the fatigue, boredom of being automatic pilot leading to failure to check and to double check. Tungod kay naanad na kaayo ka, okay? Tungod sa pagkaanad nimo, sometimes malimot na ka nga kinahanglan siyang i-double check prior or before administering any medication. Pwede pod kay tungod gikapoy ka, or you are bored, or you are thinking of something else. Next, we have the lack of checking and double checking habits. Okay, so pareha rin siya sa previous nga situation nga atong gihatag kay na ubang nurses tungod sa pagdali-dali. Okay, pwede man good na siya mahitabo nga daghan kay pasyenteng hatagan, nya daghan kay medications nga ihatag, dili na nimo ma-double check. That's why kinahanglan jud kaayo or sa tanang procedure sa medication administration, mapa-oral man na siya, mapa-parenteral man na siya. Okay, kinahanglan gyud i-double check. Okay, double check ang tanan. You double check the name of the drug, you double check the order, you double check the name of the patient. Okay, i-double check nimo ang time, tanan dapat i-double check. Okay, or i-counter check. Now, there is also one factor that is poor teamwork and or communication between colleagues. Okay? Now, if for example, ikaw lang ang maghatag og medication sa daghan kaayong mga pasyente sa imong ward, okay, or wala katabangi sa imong co-nurses, of course, kinahanglan makamagdali para ma-administer to nimo nga medication, or para maapas nimo og administer to siya nga mga medications para sa imong patients. And since wala katabangi sa imong mga co-workers, okay, most likely medication error medication error will happen. Okay, and aside from that, there is also reluctance to use memory aids. So in a field of nursing manggod, okay, maingon sila nga, mo refuse sila og isa ka procedure, or a nurse may refuse a procedure tungod kay di na siya kabalo, okay, or natay-an na sila. Of course, even though nag-work na ta, okay, or even though mag-work na ta, dapat dili gihapon na to kalimtan nga mag-update sa to ang self, magbasa-basa, okay, mag-browse sa internet kung unsay mga nga updated methods on preparing medications or ang update sa paghatag sa mga tambal. Okay? And dapat pod it pays to update yourself sa mga trends in preparing any medications. Okay? Kay pwede nga kanang nahibaw-an nimo karon lahi na sa bag-ong ginagam or bag-ong gina-practice sa hospital nga imong ginadyutihan. Now, this is the reason why we have to set a standard about medication safety. So, asa man kasagaran mahitabo ang medication error. Now, according to study, 39% okay, sa medication error happens in prescribing. Okay, so kabaw man ta kung kinsa ang ang prescribe, so ang mga doctor. Next to that, medication errors occur in the transcription. When we say transcription, kana siya kung magbasa na ta after the doctor um, after the doctor provides the patient with a new doctor's order, suwat niya dito na sa chart, kinanglan na siyang i-transcribe ni nurse, okay, or i-carry out ni nurse. So kung unsa to gisuwat ni doctor dito nga bagong medication nga ihatag ni patient, dapat nang i-transcribe ni nurse, ibalhin niya na, basahon niya, okay, and then basahon na niya, and then sabto niya ng unsay gisulat ni doctor or gi-prescribe ni doctor, dayon iyahan nang ibutang sa medication sheet. Aside sa medication sheet, dapat maghimo sad siya og medication ticket para sa patient, okay? Para guided ang other nurses sa sunod nga shift nga naay bag-ong tambal ang nga gi-prescribe ang doctor para kang patient. Now, if ever man gani sa pag-transcribe pa lang daan, pagsulat pa lang daan ni nurse, sayop na the whole medication administration process. Sayop na siya. Okay? So, next to that is 11% ang dispensing. So, who are the ones responsible in dispensing medications? The pharmacist. Okay? Kung nasayop si pharmacist og dispense, instead nga ang iyang i-dispense kay 500 milligrams o niya 1,000 milligrams ang iyahang nahatag sa nurse, okay, para i-prepare and i-administer. Okay, din si nurse, wala pod siya naglantaw, o po niya gi-double check. So, sayop na ang mahatag sa pasyente. So, next to dispensing, the next one nga naay dako og percentage or dako og percentage sa medication error is the administering. So, kinsa ang tig-administer sa medications? The nurses. Okay? So, sayop ang paghatag. Pwede pod sayop ang preparation or pwede pod sayop ang calculation. Okay? These are the standards of the medication safety. Kung kanus ang mahitabo or pila ka percentage and the whole medication regimen process, pila ka percentage most likely ma-occur ang medication error. In our setup, most of the orders or doctor's orders na ginahimo is written, okay? Meaning ginasulat sa doctor, sa chart ni patient, ang iyang mga bagong orders para sa pasyente. Okay, that is to be carried out by the nurse. So, sometimes in written medication orders, dili maklaro or pwedeng dili masabtan ang agi sa mga doctors. Okay? This is very common, okay, sa ato ang practice. Okay? There are those illegible handwriting, dili masabtan ng agi sa mga doctors. Now, according to study, 60% of physicians have illegible, okay, dili maklaro nga handwriting. So, that is a reason mong isa siya sa common cause of prescribing errors. Okay, so when naatay mga eligible handwriting, si nurse kinahanglan pa na niyang i-verify sa iyang kauban nga nurse kung unsa tong gisulat ni doctor. Okay? If dili kay ka makabasa, kinahanglan nimong i-verify sa imong kauban nga nurse. Or if si pharmacist dili kaayo siya familiar, okay, di ka siya familiar sa handwriting ni doctor, na di siya kabasa, you have to double check it with another pharmacist nga mas makaklaro sa agi ni doctor, or mas makasabot sa agi ni doctor. If dili man gani, the nurse, okay, the nurse or the pharmacist can call the doctor and verify with the doctor kung unsa tong order nga iyahang gisulat, since dili kayo siya maklaro, or dili kayo siya mabasa. Okay? So dili ra na masuko si doc ana if ever man gali mangutan nata or verify nato kung unsa tong written order nga iyahang gibutang sa chart ni patient. Okay. So kung naatay mga inaani nga mga instances or mga cases, since kinahanglan pa nimong i-verify, now there is a delay in medication administration. So pwedeng dili mahatag dayon. Nya, inig-verify nimo is dili available si doctor or unattended siya. So makahimo siya delay sa paghatag sa tambal. So it will also lead to interruption in the workflow, and then sometimes pod mo reklamo na dayon ang pasyente nga nung wala nahatag ang medication right away, that it will lead to malpractice cases. Okay? But this is not common in the Philippines. Okay? Now, here's an example of an illegible handwriting. Okay, so dili maklaro nga handwriting sa doctor. Though it is printed, pero dili siya kaayo mabasa. Okay, so I will try to transcribe this one. Okay, so in my understanding, this is diazepam. Okay, so in my understanding, or sa ako ang pagsabot aning diazepam 10 milligrams. Okay, 10 milligrams per tablet. Okay? So, dili pod pwede na nga magpataka ka og kuan, pwede pataka ka og transcribe without consulting other nurses or the pharmacist kung unsa ang gisulat ni doctor. Okay, pwede man siya god nga lahi nga medication. Okay, so let's say this is the diazepam 10 milligrams per tablet, dispense 270 tabs, meaning to give the patient 270 tabs. Iyahang to take one, daghan kaayo, 1 2 3 Q 3 tabs QR. Okay, so dili ni siya pwede nga kita lang magbasa-basa ani niya. We have to consult this one, or we have to refer this one to the prescribing physician kung unsa gyud tong iyahang gisulat. Okay? Okay, we also have another example of an illegible handwriting. Okay, so we have this one here. Pwede nga siya Unacin. Okay, pwede pud siya vancomycin. Although this Unacin and vancomycin are both antibiotics, pero lahi-lahi ini siyag subclassification sa antibiotic. Our Unacin, okay, or our vancomycin, isa na siya ka isog nga antibiotic, okay, that is considered a glycopeptide, antibiotic. So, lahi nga mga klase nga bacteria ang iyahang i-treat or iyahang i-fight compared to Unacin, that is a broad-spectrum penicillin plus beta-lactamase inhibitor. Okay? So, ingon ana. So, pwedeng masayop ta og transcribe. Okay? So, pwedeng Unacin, pwedeng vancomycin, 1.5 grams, 1.5 grams every 20 IV every 24 hours. So we have to clarify this order this order from the prescribing physician or from the attending physician. Okay? We also have another example, Protonix or Protamine. So this Protonix, it is a pantoprazole, which is a proton pump inhibitor para siya sa tiyan. And then we also have Protamine. Our Protamine is an heparin inhibitor. Okay? Para ni siya, it is considered a weak anticoagulant. So lahi-lahi nga mga classification pero murag pariha og handwriting. So dili ta maka distinguish kung either Protonix ba ni siya or Protamine. Okay? So lahi-lahi man gud siya og mga this Protonix and Protamine lahi-lahi ni sila indication. Okay, since lahi-lahi sila classification. We also have another example, the Capoten and the Cozar. Okay, so si Capoten or si Cozar isa na siya ka losartan which is a angiotensin receptor blocker or ARB. Now, we also have Capoten, that this is an ACE inhibitor or angiotensin converting enzyme inhibitor. Those two drugs para siya sa hypertension. Okay, pero ana siya'y lahi nga mga specific effects or indications. We also have another example of ineligible handwriting. This one. This is an order of irregular insulin that is to be administered now. So, dili maklaro, although mura siya glantawon 60, okay? Pero, basin 0 ni siya, pwede pod U, okay? Or unit. Okay, pwede 6 units regular insulin or 60 regular insulin now. Okay, so this is an example of an illegible handwriting. So, kinahanglan ni siya i-verify pod sa doctor if unsa ning after 6. Units ba ni siya or 0 ba siya? Now, how do we prevent and how do we respond to medication errors? So, let's follow the next slide. So, the first one is you must follow the 12 rights of drug administration. Okay? So, you must verify the order for the right drug. Okay? So, ang rights of medication administration actually sa una 5 siya. Nya, nahimong 7, nahimong 10, naadan og 2. So, naiuban, taman na sa 10 kay gi-fuse nila ang uban sa mga rights of medication administration sa uban nga mga rights of medication administration. Okay, so we have 5 plus 5. Okay, we have the right drug, we have the right client or right patient, right assessment, right dose, right time, right route, education, right evaluation, right to refuse, and right to documentation. So later, we will discuss the 12. Okay, dili lang 10. Ay kay na ay duha ka rights of medication administration nga gi-specify mo nahimo siya og 12. These are the 12 rights of drug administration for nurses, okay? Because we also have rights of administration para sa tuang or napoy mga rights mga katungod si nurses in drug administration. Okay, number one, you must consider the right patient. Okay, so it is the first right, okay, when it comes to giving medicine. So you must verify, okay, you must verify the identity of the patient. Okay, so i-check if kung mao ba yun na siya nga patient ang imong bahatagan sa medication. So how do you verify the if it is the right patient? Lantawon nimo sa chart, okay? You also need, prior to medication administration, lantawon sa nimo kung mao ba tong siya nga patient ang imo nga tagan by taking a look at the identiband ni patient, okay, and let the patient state his or her name. Okay, so to verify the identity of the patient, you ask questions like, what is your name, sir, ma'am? So, dapat open-ended question. Okay, dili close-ended uh, uh, close-ended question. Dili pwede yes or no lang. Okay? Dapat makastate sila sa ilahang name. What is your name, sir, ma'am? Dayon. Or you can say that, could I have your name, please? Or could you tell me your full name, please? Or you can say, I just need to verify your name and you'd be Miss Blank, and then sila na ang musumpay. So, sometimes a sick patient trusts that their healthcare provider, namely the nurse providing hands-on care and a doctor who spearheads the medical treatment, will administer the medications correctly. So, isa na siya sa responsibility that weighs heavily mainly on us, the registered nurses, or you, future nurses. Now, since most of the time we are the ones who are giving the medications, we carry out the doctor's order. There are protocols now we need to follow when we administer drugs to our patients. So, it is our utmost importance that we follow the right procedure of giving medicine to keep the patient safe from harm and to help them get well. So, whenever man gani you find yourself practicing your nursing profession or pohon, enigma nurses na mo, you should always keep the rights of the medication administration by heart. Okay? And it is these rights that you should become a mantra that you recite in your head as you verify the information pertaining to the patient as well as do the right nursing intervention related to drug administration. Okay, so you ask the name of the patient again, you check is his or her ID band before giving the medication, and even if you know the patient's name, you still need to ask, okay, just to verify. So that is for the first right, okay, the right patient. Now, um, okay, so these are some of the ways. You check the bracelet, address the person by name before giving the drug. So after na makastate siya sa iyang name, for example, thank you for giving me your correct name. Dayon, address na dayon ka sa patient. And always double check orders that the client questions. Okay? So next we have um, just a reminder for the right patient, never ask a yes or no question. Mo nang ang giingon ka ganina is dapat open-ended ang question. Okay? Dapat open-ended ang question. Dili lang close-ended like yes or no when verifying the right person. Since confused patient, pwede na silang makaingon og yes maski dili mao, okay? Or no to a question or situation that may not have a full mental capacity to comprehend at the moment. Okay? Pareha ang mga cases nga patient gikan sa OR. Okay? Sedated pa nga mga patient. Pataka na sila tubag. Okay? Wala kayo nila naklaro ang imong pangutana, may nga siya yes or no. Or if the patient is in pain or not feeling well, pataka na sila tubag. So, dapat ma-verify nimo iyang name by ma-verify nimo ang name sa patient by letting the patient state his or her full name. Now, second, always let them provide their full name. So, dili kay first name lang, dili kay last name lang, okay? Because there may be another patient of the same ward or the same room with the same first name. Pwede po pareha og nickname or pwede po pareha og family name. Now, there are situations wherein you will not be able to ask the patient directly. Such as when the patient is in a stupor or pwedeng unconscious, confuse ang patient. Now, if this instances arises, now verify the patient's identity by reading the identiband. Okay, kanang bracelet the patient kinaiyahang name prior to administration. Don't rely on just verifying the identity by the name or the room, since the patient can change rooms and can change beds. Okay? So next we have the second right. We have the right drug. Okay. So in verifying or in practicing the right drug, this means that the client receives the drug. Okay, receives the drug that was prescribed. Okay, correct drug that was prescribed by the doctor. Okay, for hospitalized patients, the drug orders are written as a dapita sa doctor's order sheet. Okay, makita nimo ang mga tambal nga gireseta ni doctor or gi-order ni doctor sa doctor's order sheet. Kauban sad siya sa mga other treatment orders na ibutang dito and other intravenous um, orders, okay, duly signed by the authorized person. So, who is this authorized person? Kung si doktor, siya ang nag-order, dapat siya po ang nag-sign. Okay. Now, unsa ka mga instances pwede na ay mo substitute, okay? This is not necessarily substituting the doctor, okay? For example, wala dira si doctor dayon naa siya gitawag nga order, okay? So that order is called a telephone order, okay? Or a phone order. Phone order. So, in the event nga na ay phone order, so the nurses nga naka-take sa call, isulat diretso niya sa doctor's order sheet, ang order ni doctor, okay? You verify it the you verify pod nimo ang order niya kung insakto ba. For example, nag-order si doctor paracetamol 300 milligrams IV PRN. Okay, every 4 hours for temperature 39 degrees Celsius and above. So, kung mao na gisulat ni or gistorya ni doctor, i-verify po nimo like mayon kag doc, i-verify lang nako ang imuhang order, ibaliko nimo og basa kung unsa tong imuhang nasulat. Okay? Sakto ba ni siya, doc? Mayon si doc, yes, sakto na siya. Okay. So, imuhang buhaton is since this is a phone order, you will write down your name didto sa ubos. Okay? After the order, the last order, ibutang nimo didto PO by Dr. blah blah blah. Okay? By Dr. Blank and then butangan nimo sign like J Densing RN dayon sign na nako. Okay. Now, time comes na mobalik na si doctor or muraan sa siya balik, ipa-counter sign ni doc. Okay? Pa-counter sign ni doc ang order or ang phone order nga iyang gihatag. Okay? It is also applicable to verbal orders. Okay. So, ang kanang mga verbal orders, mao na siya nga mga order nga wala nasuwat ni doctor. Okay? Mao na siya nga mga instances. Okay? That is a verbal order. Okay, balik ta. All telephone orders, okay, for medications must be co-signed by the physician who ordered it within 24 hours. Okay, if makita nimo si doctor og balik pa countersign na nimo. Okay, so you check the drug label 3 times before administering the medication. Okay, you check the label, drug label, unsay naa dito nakasulat sa butangan na niya 3 times before administering the medication. Lang tawag balik kung maubag yun, kung mauba siya nga tambal, same bag generic name, mauba iyahang dose, okay, mauba sa imong gi-calculate, kung unsa ang method of administration, i-check pod nimo dito. Okay? So, you check the label 3 times and know why it is ordered for the patient. Okay? Dapat kang may balo. Okay? Nga nung gi-order na siya sa patient. Now, in verifying whether it is the right drug, okay, dapat na ni siya nga mga components of drug orders. Number 1, dapat na ay full name ni patient. Okay? Dapat na ay full name ni patient. Nakabutang dito, pangalan, apelido ni patient. And it must have the date and the time the order is written. Okay? Kung kanus siya gi-order, dapat pabutang dito. Okay? Full date and full time. Okay, you indicate if it's A or the doctor must indicate whether AM, PM, then full date. And we also have the drug name. Okay, so generic name. Okay, dapat generic name. Kung pwede sad, trade name ang ibutang. Okay, depende man na siya sa hospital policy. Pero kung nag-observe to sa generic law, okay, dapat generic name ang nakabutang. Okay, we also need to write down the drug dosage, okay? Unsa ang milligrams nga gi-order ni doc para sa patient. Okay? And also the right route of administration, kung PO ba siya, okay, kung IV ba siya, okay, intradermal ba siya, subcutaneous ba siya, suppository ba siya. Okay? So, the frequency of administration, kung ikapila siya ihatag within the day, okay, for example, every 4 hours or 2 times a day or 3 times a day or every 24 hours. Okay? Kung ikapila ihatag, okay, ang tambal. Okay, we also need to provide or the doctor must need to provide the signature. Okay? Name and signature. So, ang mga doctors karon is magdadaan naman na sila ilahang mga stamps and they would stamp nila ilahang pangalan, then ilahang permahan. Okay? And the nurse will need to look up the medication order to know its classification. Okay? Mo nang dapat mahibalo si nurse kung unsa nga tambal ang gihatag o why the drug is ordered. Okay? So, the nurse must also need to know, okay, unsa ang classification, unsa ang safe dose, unsa ang mechanism of action, and how to administer that certain drug. And also, dapat may bawas sila sa side effects. Okay? And next to that, okay, we have this one. Now, we have categories of drug orders. First, we have a standing order. So, a standing order, these are protocols, gihimodaan or pre-made, derived from guidelines created by healthcare providers for the use in specific settings or for treating certain diseases or set of symptoms. So, kaning mga standing order is, gina-create ni siya nga mga protocol. For example, in emergency cases, okay, kita hay wala dila si doctor or nay nakaset daan nga standing order nga mao ni dapat buhaton whenever that situation or that scenario arise. Okay? So, in standard order, it may be an ongoing order. Okay? It may be given for a specific number of doses or days. Okay? Ang standard order man good is pwede ni siyang i-order ni doctor daan sa first day pa lang daan sa admission ni patient, and then i-continue lang siya. Okay, i-continue lang siya. That is a standard order. It may also include PRN orders. Okay, we also have one-time or single order, meaning any medication nga gi order ni Dr. Annie or any procedure nga gi order ni Dr. Annie, it is given once and usually at a specific time. Okay? So, mo na siya one time or single order. So, after nahatag na siya, after administer na siya, you stop. Okay? Stop na dahil na siyang order. Okay? For PRN orders, these are medications or procedures given, okay, at a client's request, okay, and the nurse's judgment concerning the need, okay, the need and safety. So, as necessary lang ang mga PRN orders. For example, sa cases sa mga analgesics or sa cases sa mga antipyretics, now, mostly those medications under PRN orders is ihatag lang sila kung magkinahanglan si patient. For example, kung maghilanat lang siya, hatagan siya antipyretic every 4 hours kung naihilanat. So, dapat na ay condition. Okay, ma-meet to siya nga condition in PRN orders. Or for example, if the patient complains of pain, okay, ihatag to siya nga pain reliever kung mag-complain lang si patient. Meaning, dili siya ihatag continuously. Okay, those are PRN orders. We also have stat orders. Okay, this stat order is given once. Okay, once immediately. Diha dayon. Okay, ASAP. Those are stat orders. Okay. Okay. Another explanation of the right drug, okay, under the rights of drug administration, is to avoid the dreaded medication order of giving the wrong medicine to a patient. So, dapat mag-read ta and reread the label of the medication, okay, across different stages of drug administration. Now, pag-prepare pa lang daan or pag-order pa lang daan, check na nimo. After ana, inig-request nimo sa drug or sa tambal, i-check na po nimo kung sakto ba. Okay? If i-dispense na sa pharmacist, ang tao nimo kung sakto ba tong gi-request ni doc o ang gihatag sa pharmacist ng mga tambal, i-check na nimo. Prior to preparing the medication, i-check na po nimo kung sakto ba ito imuhang gi-prepare. Inig-administer na po nimo sa tambal, i-check na po nimo kung sakto ba itong gi-order ni doctor o kay imuhang i-administer nga tambal. Okay? So, for example, before you withdraw the drug from the vial or ampule, you check it and before you pair it with your medication ticket. So, itandi siya. Okay? I-read and read and reread, okay, or recheck. And also, read the label of your medication again and compare with your medication. Ticket to see if it matches before administering. So, manong makaingon ta nga, you have to recheck it across the different stages of drug administration. Okay? So, next is we have the right preparation. Okay, the third right is the right preparation. So, kanasa na to ihimo ng right preparation. So, after you verify what you have is the right drug, kung na-verify ni mga insakto na siya nga tambal, you need to check if you have the right preparation. Okay, so we have different forms of medication preparations that are available, okay, for almost any given drug. Okay, ang preparation is pwede po siya mga drug forms, okay, katong mga solid dosage forms, mga liquid dosage forms, semi-solid dosage forms, so mo na siya ang right preparation. So, ang preparation niya, pwede siyang pills, pwede siyang tablets, capsules, spansules, syrups, drops, solutions for injection. Okay, pwede sa vial or sa ampule. Pwede po powder for injection. Okay, the difference between solution for injection in a vial or ampule and a powder for injection is usually, ang powder of injection is naana siya sa isa ka vial. Okay, powder na siya. Kinahanglan na siya reconstitution or reconstitutan og sterile water or NSS para ma-dissolve tong mga powder para inighatag na to niya intravenously. Okay, dissolve na ang mga drug particles, okay, for easy administration. So, muna siya. Ang solution for injection is in liquid form na siya daan. Dili na kinahanglan ni mo reconstitutan or butangan o kanang sterile water or PNSS. Okay, we also have another drug preparation or drug forms like the ointments, gels, patches. Okay, ang patches katong ipapilit lang siya sa skin. For example, katong nitroglycerin patch or katong contraceptive nga patch. The ointments, okay, usually ang ointment is kuan siya clear, and then ang gel pod is clear pero mas oil-based ang mga ointments compared sa mga gels. We also have aerosolized spray. Okay, parihaan ng ang kung magamit og inhaler. Okay, it comes in a aerosolized spray. Pwede pod lozenge, katong murag candy like the Strepsils. We also have paste and we also have suppository, katong isoksok sa rectum. Okay. Now, the nurses must adhere exactly to the type of drug preparation indicated by the doctor. So, dapat i-follow. Because different types of preparation could produce potent, okay? Pwedeng, if for example, IVC, or compared to the IV and the oral, so mas potent ang IV, okay? And less potent or delayed or unwanted expedited results when a right drug is given to the patient in a different preparation. Okay, so muna siya sa right preparation. Now, next we have the right dose. Okay, so once you are certain with the name of the drug and the type of preparation, the next thing that you would verify is the amount. Okay, the amount of the drug, okay, to give for the right dose. Okay, this refers to the dose prescribed for a particular client. So, lahi-lahi nga patient, lahi-lahi nga mga indication, lahi-lahi nga mga cases, lahi-lahi pod ang dose ni patient. Okay, dili pariha ang analgesic nga ihatag sa bata or antipyretic nga ihatag sa bata, lahi pod na ang dose nga for adults. Okay, so what is the nursing implication for this one? You must be familiar with the various measurement system and the conversion from one system to another. Okay, mga common nga mga conversion is kanang grams to milligrams, pwede pod mga pounds to kilos, okay, pwede sad mga tablespoons to ml. Okay, so those are examples of measurement and conversions. Next, we have for the right dose, you should review your drug calculation formulas as well as your conversion equivalents for units to provide an accurate measure of the right dose of the right drug to the right patient. Okay. So, if maghatag ka, if you give more than what is indicated, pwedeng ma-overdose ang patient. Okay? Pwedeng ma-overdose ang patient if you give more than what is indicated. So, dapat mag-compute yun og insakto. Okay? Now, kung na-overdoses nga patient, okay, maana siya unintended or untoward effect. Okay? So, if you also give less than the indicated dose of the right drug, pwede pod nga ma-underdose si patient, which may lead to therapeutic levels of the drug in the body to produce the unintended result. Okay? So, dili siya maayo og dali, okay, sa expected day nga maayo siya because you are underdosing the patient. Okay, you need to give the exact order amount of the medicine or the right dose to achieve the right results. Okay, so you must check the medication sheet and the doctor's order before the medicating and be aware of the difference of an adult and the pediatric dose. Now, we have nursing implication. So, muning giingon ka ganina nga you must be familiar with the different measurement system and the conversion from one system to another. You must be familiar with this measuring devices. We have this one. This is a medication cup. Okay. Dropper. Okay, we have a syringe. Okay, kanisha. Okay, 1 cc syringe, or we call this one as the tuberculin. Okay, 1 cc. Okay, so kanisha tama na din siya 1 cc ang calibration niya. We also have another type of syringe nga gamay gihapon. This is called the insulin syringe. Now, ngano insulin syringe ang tawag sa iya is usual nga medication na ginagamitan aning insulin syringe is the insulin. Okay, so it usually comes in units. Okay, units ang iyahang measurement. Okay, instead nga ml. Okay, so mo na siya sa insulin. And kasagaran is ang difference silang duha, although pareha sila nga makadeliver og 1 ml or 1 cc, lahi sila og calibration, kaning isa ml, kaning isa units, and then ang needle aning insulin syringe is non-removable, hindi siya matangtang, while this one sa inyong tuberculin syringe is madetach. Okay, so this one for the use in administering 0.5 to 50 ml of medication kani sila. Kani silang mga measuring devices. Okay? So common po ni siya kaning measuring cups and droppers sa mga pediatric patients. Okay. So ang kaning measuring cups nato nana siya yung mga calibrations 5 ml, 3 ml, 10 ml until I think 20 ml ang mga measuring cups. Now, the nursing implication, always use the appropriate nursing device and read it correctly. So, in reading correctly, okay. So, if for example, pareha sa chem na to. Okay. So, when you read the level of the medication, dapat tantaw ta sa lower meniscus. Okay, lower meniscus to avoid error of parallax. Okay, so always measure the volume of liquid medication at the lowest point of the meniscus. Okay, so again, to avoid the error of parallax or parallax error. You shake all suspensions and emulsions because in suspensions and emulsion is nakasuspend ang imuhang mga powders. Okay, kinahanglan siya i-shake prior to use kay ang katong naa sa taas is most likely mga kuan lang to siya, mga syrup lang to siya or the sugar nga na-contain sa isa ka syrup. So ang tambal yun nimo, which is the active ingredient, na siya sa bottom. So, need siya i-shake, okay, for the emulsions and suspensions. Pero, if it is a syrup, no need to shake, okay, kay evenly distributed naman kung sa syrup compared sa emulsions and sa suspensions. Now, when measuring drops of a medication with a dropper, always hold the dropper vertically, okay, and close the medication cup. Okay, so hold the dropper vertically. Okay, and then close to the medication cup. Okay, do not attempt to divide unscored tablets. Okay, unsay mga scored tablets di ay? Kung nagali kay makita din ha nga line or demarcation din ha sa tunga-tunga sa tablet, that is a scored tablet. Okay, so if wala siya linya, okay, that is an unscored tablet. This is an example of a scored tablet, man God. So do not attempt to divide unscored tablets and do not administer tablets which have been broken and evenly along the scoring. Okay, so if naagali kay scored tablets, unya, na dali siya na natunga, okay, natunga. So ayo siya ihatag. Dapat kung unsa tong gihatay, for example, ang order sa doctor is half of this tablet lang. So, dapat half. Okay? Ang half niya is kaning na line. Okay? Na scored line niya. Okay? So, next to that is when preparing an injectable medication, dapat you will determine the exact volume of drug to be administered. So, how do you determine the exact volume of the drug to be administered? Dapat i-compute or i-calculate nimo. Okay? Dapat insakto ang imong pag-compute para maka-extract ka og exact volume sa medication. Now, you select the right type and size of the syringe and the needle. For example, if ang imuhang tambal is gamay lang siya, less than 1 cc, so di ka magamit og 3 cc nga syringe. Okay, di ka magamit og 5 cc or 10 cc nga syringe. Of course, imong gamiton isang tuberculin syringe. Okay, for example, ang imuhang medication na kinahanglan kuhaon from your prepared medication is 6 cc or 8 cc, dili nimo siya andamon sa 3 cc nga syringe. Kay taman ra man pod to siya 3 cc or 3 ml ang 3 cc nga syringe. Or taman ra pod 5 ml ang 5 cc nga syringe. Okay, dapat adto ka 10 ml nga syringe. Okay, you use the right type and the right size of syringe and the needle. Okay, so when removing a drug from a multiple dose vial, okay, multiple dose vial kanino siyang naidako bitaw nga vial. Okay, for example, this one. Dayon, ang sulod ani niya is 1 gram. Okay, or 1,000 milligrams. Now, if for example, magkuha lang ka ana niya og balig 500 milligrams, so naibilin nga katunga. Okay, naibilin nga katunga ana niya nga vial kay 500 milligrams raman ang imuhang kuhaon niya. The medication comes in 1 gram or 1,000 milligrams. So, when removing a drug from the wipe the stopper. Okay, this is the stopper. Kana siya. Kanang dira, okay, kanang murag na rubber nga part, that is your stopper on the vial with an alcohol sponge. Okay, so cotton nga nay alcohol or alcohol wipes, i-wipe din ha. Okay, and let it dry first before ka magkuha. Okay, so inject an amount of air into the vial. Okay, dapat ka mag-inject. Okay, inject nimo kung pila tong imong kuhaon nga ml or volume sa imuhang vial, dapat moupod to siya air nga imong i-inject didto sa vial. Okay, para inig-withdraw nimo sa imuhang medication, dili ka maglisod. Okay? Kung pila tong imuhang desired, for example, 5 ml lang imong kuhaon, so dapat mag-instill po ka, mag-inject sa kag 5 ml nga air. Kay ngano, automatic nga inig-press nimo sa imuhang syringe from dito sa imuhang vial, mood down ra na siya iyaha. Okay, because of the injected air nga imuhang because of the air nga imong gi-inject dito sa imong vial. So easy, dili na ka maghago og bira-bira pa kung magkuha ka og medication sa isa ka vial. Okay? Kung pila tang imuhang i-aspirate or kuan from the vial nga liquid, dapat maupod nga air ang imuhang ipasulod. Okay? So that's for the injectable medication in a vial. Now, if there are air bubbles in the syringe, these must be removed by holding the syringe with a needle towards the ceiling and tapping. Okay? So, itap nimo. Okay? Tap nimo ang imuhang syringe and then sa ceiling ha, Okay, make sure nga kung mag-tap ka is away siya sa imuhang mga kauban kay what if wala kay nimo natarong og close ang imuhang needle. Nya nag-tap ka rin ha. So unsa may hitabo? Ang katong needle pwede siyang mulupad, okay? Padung sa imuhang kauban. Okay? So tap, okay? Hinay lang nga pag-tap. If there are air bubbles in the syringe, these must be removed by holding the syringe with the needle toward the ceiling and tapping the syringe with your finger to move the bubbles toward the hub. So, musaka man na siya kung itap nimo. Musaka ng bubbles ito sa taas. Okay? Inigsaka na niya, okay, i-push dayon nimo siya. Push din nimo siya para ma-expel tong air. Kaya ang mabilin is ang katong liquid na lang. Kaya nganong dili pa ana. Kaya ngano, inigana nimo ang katong bubbles, musaka siya padung sa dito sa imuhang plunger or padung sa end. So maglisod na noon kag pa-expel. So dapat naka naka-position siya pataas para dito sa dali ra nimo ma-expel ang air inigna na siya dinhi sa tip. Okay? So, when medication in a glass ampule, flick the top of the ampule. Okay? I-flick nimo ang top sa ampule. To be sure that all medication is in the larger bottom of the portion. So, wrap the neck of the ampule with dry gauze and snap off the top. Okay, so this is an example of your medication in your glass ampule. So, ang nakabutang din when the medication is a glass ampule, flick the top. Okay, so this is the top portion of your ampule. So, i-flick mo. Okay, para ang katong mga nasuspend din nga mga medications, okay, mo down siya. Okay? So, sahay magud labi na katong mga gagmay nga mga ampules, daghan kaayo kintahay kung matilt siya. So, tay kung may nani siya, nay mabilin nga liquid in here or solution. So, i-click lang ninyo siya, itap para munaog. Okay? So, kung wala na, okay, naman na siya yung demarcation line din here. So, ang kaning demarcation line, so, i-wrap lang mo siya, okay? Dayon, i-flick. Okay, i-flick mo siya and snap off with the top. Okay, so, if dili ka anad or mahadlok ka nga mag-flick and use a gauze pad and snap off the top. Na may mga ampule cutter. Okay, na mga ampule cutter, use that. Okay. Now, avoid doing this one. Okay? Avoid flicking it with a scissor. Okay, dili siya advisable nga magamit og scissor. Okay, or any hard objects. Okay, why? Okay. So, this is not advisable nga kani imong okay, dili siya ngano. Pwede nga ma-break ang mga glass particles ani niya katong gagmay tiny nga glass niya mapadung sa dinhi sa imuhang tambal. Yeah, nig-aspirate nimo ana sa tambal, man-apil to siya. So, pwedeng mapunta sa imuhang gagmay kaayo nga mga parts nga pwede siya imong gigamit nga needle is katong large bore needles pwede nga maapil inig administer ko hapdos kay sa nga tanan. Okay? So that's it. Now, this time let's discuss the right time. Okay. So the right time is the time at which the prescribed dose should be administered. Okay, so what is a nursing implication? What are the nursing implications? Now, to achieve maximum effectiveness, medications are scheduled to be administered at a specific time. Okay, so gina-schedule na siya at a specific time. Okay, so you administer drugs that are affected by food such as tetracycline and penicillin before meals. So dapat kang mahibalo if that certain medication is affected by food. Mo nang reason nganong there are medications nga taken with food or without food, because if those medications nga i-take nimo siya nga dapat without food siya, pwede man ang food nga imong gikaon is maka-impede siya sa absorption sa tambal. Okay? So, administer drugs such as potassium and aspirin after meals or with food, okay, para easy ang absorption sa tambal. Now, it is the responsibility of the nurse to check whether the client is scheduled for diagnostic procedures such as endoscopy, fasting blood sugar. Okay, so sa imuhang shift, if naakay nakaschedule nga, mintay night shift ka din, naay nakaschedule nga patient fasting siya for fasting blood sugar. Okay, so ang imuhang buhaton is i-check siya daan, if na order nga for fasting para dili nimo siya mahatagan og any PO meds kay ngano if you give PO meds niya then PO dapat si patient so dili to madayon to nga procedure because nakahatag man ka og tambal siya or nakapainom ka og tambal sa iyaha. Now there are also some orders ng NPO. Okay, NPO siya pero pwede maghatag og PO meds. Okay, naay mga orders nga inana. So, naay modification sa mga orders. So, you also check the expiration date of any medication nga ihatag sa patient. So, kung kuan gani, kung if ninglapas na sa expiration date or if duol na sa expiration date or kana ning tungtong na siya hapit sa expiration date, you discard the medication or depende sa hospital policy, i-return na siya sa pharmacy din. Ang pharmacist ang responsible na indisposing the drug. Okay? Kay na may lahi-lahi nga mga methods or nas lagi sunod nga protocols on how to properly dispose expired medications. Pwede man pud good na siya mauli sa ahente or sa agent nga drug if expired na. Depende lang na siya sa hospital protocol. The antibiotic should be administered at even intervals. Okay? Even intervals. Dili siya pwede nga mulapas ka or mugubiyan ka sa time or mules ka sa time nga giset para sa para sa antibiotics. Okay, usually over a 24-hour period ng ang antibiotics. Okay, para ma-maintain ang therapeutic blood level. Meaning, ang therapeutic blood level is ma-maintain kung unsa or ang presence sa tambal dinha sa imuhang systemic circulation. Okay. So, mo na siya for the antibiotics. So, if for example, ang nurse kay daghan kay siya gihatagan nga mga tambal or gi-prepare nga mga tambal. So, naaman nay allowance ang mga tambal. Okay, for example, pwede kag ma-delayed og mga 30 minutes. Okay, 30 minutes lang. Okay, pwede pud kag mag-advance og mga 30 minutes sa iyahang scheduled or sa iyahang specific time nga gibutang dito sa iyahang order sa medication sheet niya. Okay? So, the prescribed time, pwede siyang less than 30 minutes before the prescribed time or pwede po siya after 30 minutes mahatag. Within that time frame lang. Hindi na pwede mo lapas. Now, you must consider the half-life, okay, in the right time. So, the half-life refers to when the total concentration of the drug is reduced by half over and over again. For example, if the medication has the half-life of 4 hours, meaning ang katunga sa tambal, okay, ang total concentration sa tambal is ma-half siya. Like, 4 hours ang iyang half-life. So, at after 4 hours, na nagpabilin nga 50% sa tambal. Okay, 50% sa tambal sa systemic circulation. Okay, dili na siya diha dayon ma-excrete. Okay, naghapoy certain amount ka magpabilin sa imuhang circulation. Okay, so different hospitals have different rules and regulation pertaining to drug administration. Naiuban ay put 30-minute allowance from the set time of a dose while others provide a leeway of 1 hour. So follow the standard protocol of your hospital. So dapat lang gyud nga ang stat is mahatag dayon immediately. Okay, mo lang siya dapat i-consider gyud pag-ayo. Ang stat, it must be given immediately. So you administer the drug first before completing your medication rounds. Okay, so di na ka kung na mga stat nga mga orders, ihatag dayon ay napaghulat kung kanus ka maghatag sa imuhang sunod nga mga tambal sa uban nga mga patients. Okay? So, that's it for the right time. By the way, here are the standard timing and their Latin abbreviation. So, once a day, okay, or OD, okay? So, once a day, okay, OD. So, BID, we have bis in die, or twice a day or 2 times a day. TAD, tier, ter in die, tier. It's tier in die, or thrice a day or 3 times a day. We have QID, quarter in die, or 4 times a day. We have PRN, that is pro renata. Okay, pro renata, as needed lang siya ihatag. Now, let's move to the sixth right of drug administration. We have the right route that is necessary for adequate and appropriate absorption of drug. So this includes the correct route of administration, okay? Correct route of administration and in such a way that the client is able to take the entire dose of the drug to receive the maximal benefit from it. So, the nursing implications include dapat kang mahibalo sa prescribed route by which the medication should be administered. Kung nakabutang dito PO, so ihatag siya nga PO, dili siya ihatag suppository. Okay? By mouth. Kung nabutang dito nga intradermal, dapat ihatag nimo siya intradermally, dili siya subcutaneous. Kung IM, dili siya pwede ihatag nga IV. So, dapat i-follow tong prescribed route kung sige gi-order ni doc. Okay? So, if no route is specified in the order, the prescribing physician should be questioned about the intended route. Okay? So, this means nga you can question, okay? You can ask the prescribing physician kung if he or she fails to specify the route of the medication. Okay? So, pwedeng mangutana. Dayon, i-note lang dito sa imuhang doctor's order. Now, always gain the client's cooperation. Okay? So, in gaining the client's cooperation, mag-state ka sa imuhang name, the purpose of the procedure nga imuhang i-perform sa imuhang patient. Okay? Before attempting to administer a dose of medication. Okay? So, you also consider the client's developmental level during administration of medication. So, kung bata ba ang tagaan, kung tigulang ba ang tagaan, or kung adult ba ang tagaan. Now, if you need assistance, okay, mangayog assistance sa significant others. Okay, for example, if bata ang imuhang hatagan, kay na may ubang bata, they are afraid of nurses and doctors. So, kung ilang mama or papa ang maghatag, ni okay ra sa ilang mo na magtambal. You also assess the client's ability to swallow prior to administering oral medications. Okay? Kung makatulon ba or dili. If dili, you tell the doctor nga dili makatolerate ang patient para maka-prescribe siya or ma-change niya ang prescribed route of administration. Use antiseptic technique when administering drugs, especially in parenteral ones. Okay, this is intended for systemic circulation. Now, in the right route, there are a variety of routes to administer. Okay, so you must be familiar. Okay, you must be familiar with the things to do and the things nga dili dapat buhaton. Okay, so dapat kabalo ka maghatag og PO, mamaster na nimo, mamaster na kaghatag og parenteral medication og suppository. So, mamaster nimo na dapat ang tanan. You avoid medication errors by reading the doctor's order and the medication ticket accurately, since many drugs have various preparations or variant preparations. So, drugs that are commonly given orally may need to be given intravenously in more emergency cases. For example, immediate intahay ang pasyente is nagkinahanglan na siya sakit kay iyang tiyan. Okay nya dili ka makahatag niya og PO nga complain na siya og sakit kay nga tiyan, so dapat IV ang ihatag niya. In that case, dapat mag-refer ka daan sa doctor if dili niya matolerate or gusto ang patient o ganang immediate effect sa tambal. And so familiarize yourself with this, especially since some drug administration routes produce quicker results than others, while some routes produce more longer and sustained blood levels than the others. In the right route, you consider the different routes and their abbreviations, such as enteral administration, so directly to the intestine. So example, ani niya orally, by mouth, per orem, monang PO ang iyang abbreviation. Sublingually, under the tongue. Okay? Or ang abbreviation niya SL. Rectally, in the rectum, per rectum, or PR. Okay, so those are examples of enteral drug administrations. We also have examples of, or we also have parenteral drug administration route, meaning dili siya enteral. So, dili na siya muagi sa intestine. Okay? So, ang kaning mga parenteral through the needle. Okay? So, examples, IV, intravenously, into the vein, intramuscularly, in the muscle, IM. We have subcutaneously, under the skin, pwede SC or SQ or sub-Q. Pwede intrathecally, sa spinal canal. Okay, pwede po sa subarachnoid cavity. Transmucosally, so mucosal lining, okay? So, mucosal lining of the body absorb the medication. So, pwede po SL, okay? It's part of the internal route under the tongue, vaginally, per vaginum, PV, okay? Nasally, mucosal lining, okay? Nasal cavity, buccally, sa cheek, inside the cheek, okay? And then ocularly, used in conjunctiva or the mucosal lining of the eye, especially kanang mga ophthalmic ointment. We also have inhalations. Okay, inhalations, parehaan ng sa mga pang-asthma mga medications. Okay, other routes and abbreviations, inhalers. Okay, so natay inhalers, patient actively inhales a dry powder or liquid medication that is contained in an inhaler or with a mouthpiece for delivery. Parehaan ng kung mag-nebulize ta. Okay? It's an example of a inhaler. Okay? Pwede pod mga pressurized meter dose inhalers, kanang puff. Okay? Pwede pod nebulizers. Okay? Nebulizers kay butang siya sa isa ka nebulizing kit. Dayon, butang dito ang tambal. Dayon, naay compressor, okay, or naay nebulizer nga gamiton para ma-dispense or ma-administer to nga tambal, ma-inhale na nimo siya. Or pwede gamitan og oxygen tank. Okay, so napay daghan nga mga routes of medication administration nga pwede natong tun-an. And the next to this one is the right reason. Okay. Ang right reason, dapat mahibalo ang nurse sa rational or the reason nganong gihatag na siya nga doctors or nganong gihatag na siya nga order, nganong prescribe na siya nga medication sa patient. So, as a general rule, okay, dapat i-follow niya siya. Never give medicine that you do not know the reason for. Okay. So, dapat na siya. Kung wala ka kabalo sa rason nga nung gihatag nga tambal, ayaw ihatag ni patient. Okay, so you study the drug nga ihatag ni patient. Kay, ngutan naman na si patient nga nung gihatag ni siya nga medication para asa ni siya nga medication. So dapat mahibalo gyud si nurse unsay indication kano siya ihatag, ngano kinahanglan siya ihatag. And its mechanism of action. Okay? Aside from the reason that you should know the action, pharmacokinetics, and the possible side effects, if any of the drug being administered to the study, as ni siya makitaan. Okay, pwedeng sa leaflet, okay, pwede po sa mga drug handbook or sa internet sources. Okay? So, you should know the reason because your patient and his family are going to ask you why. And kung mga tanong sila, nakay answer. Okay. So next to that is the eighth right, which is the right to education. Okay, or the client's right to education. Okay, so this right is a principle of informed consent. Okay, informed consent. So, pare-pareha ni siya sa katong previous right. No, mao nang naiuban nga gifuse nila ang right to know, okay, or right reason and the right to education. So, pare-pareha na sila og principle nga informed consent, which is based on the individuals having the knowledge to make the decision. So, unsa ang mga information nga dapat nimong ihatag kang patient? Okay, as part of your health teaching or patient teaching, we have the name of the medication, purpose nga nang gihatag nga medication. We have kanus-a ug how the medication is to be taken, how to monitor the drug's effectiveness. For example, kung maghatag ka og antihypertensive nga medication, dapat i-check ang BP prior and after giving the medication. Okay? Para makaibalo ta kung effective ba ang gihatag nga tambal. Okay? We also need to teach the patient the foods and the drugs that may cause interactions. Okay, also the possible adverse effects and the signs and symptoms nga ilahang ma-experience and unsa nga mga signs and symptoms or possible signs and symptoms nga kinahanglan na og doctor's attention or pwedeng itawag sa doctor, and the proper storing and handling. No, kung na ay kulang ani nga mga topics, okay, meaning dili proper ang paghatag or pag-administer nimo sa tambal. If nakay ma-miss ani niya, partially correct ang pag-administer sa tambal or partially correct ang medication regimen. Okay, kung naay mga kulang ani niya. So, you provide enough knowledge to the patient of what drug he or she would be taking and what are the expected therapeutic and side effects of the medication. Okay? So, also in the right education, before you administer your drug to the patient, you first need to educate them, okay, about the medicine that they are going to take. Okay, so unsa iyang generic name, okay, o possible nga brand name if applicable. Okay, if dili na siya available nga brand name, pwede pod ka makahatag og alternative, okay, nga brand name. Okay, basta kay parehas lang siya og generic name o parehas og dose. Okay, so pwede naman na siya in the principle of parehas sa bioequivalence kanang mga generic name kay pareha ra na sa mga anang mga generic drugs pareha rin siya sa mga branded. So akong giingon sa inyo na mong uban is mahal ang katong mga branded drugs because they are paying for the patent, they are paying for the advertisement of the drug. Kay mo nang medyo mahal sila. But for the bioequivalence, same ra na sila og effect. Okay? So you educate them about the action of the drug, okay, in simple terms lang, okay, in simple terms. Dili kaayo necessary nga technical ang pag-educate sa mechanism of action, okay, so dili kaayo technical. So, and the reason why the doctor prescribed the drug. So, also inform them about what to expect when they take the the medications, unsa ang mga intended therapeutic effects, ug unsa putong mga possible side effects if naa. Okay? So, next is the right to refuse. Okay? The right of the client to refuse a medication. Okay? Clients can do and refuse the medication. So, before ta mag-practice ani, make sure nga nakasabot sad sila kung unsa ang mga tambal nga ihatag sa ilaha. And para mahatagan sila or malamdagan sila if ever man gani ang reason nga ning refuse sila sa tambal is wala sila kaayo nakabalo para asa, okay, unsay effect niya, unsay mga side effects niya. Namang mga instances nga nana, okay? Na yung mga mama, na yung mga papa nga maingon sila nga dili lang may magpahatag ana nga tambal para sa among anak, dili man epektibo. Okay? So, pwede na siya. Pwede na sila katungod nga mo refuse. Okay? Pero, pasabtundaan si patient, nga nung kato siya nga tambal, is mo gi-suggest ni doc. Okay? So, nursing implications for this one, by the way, in observing the right to refuse, you give the client enough autonomy, okay, to refuse the medication after thoroughly explaining the effects. Okay, so what are the nursing implications of this 10th right? We have, be sure to assess the client's reason for refusing the medication. Okay, dapat mahibalo si nurse or you assess nganong, sir, nganong ning-decline mo, nganong ning-refuse mo, unsa inyong rason, okay, para malamdagan sila later on. So, if there is knowledge deficit manggod, okay, nganong ning-refuse si client, sa paghatag sa medication or pagpahatag sa medication, you provide appropriate explanation why the medication is ordered. Okay, dili lang kay kitungod dili sila, dili na lang pod. Okay, dapat explainan sila pag ayo. What if wala lang sila kaayo na inform? Okay, or dili klaro sa ilaha. Okay, and you document if the client refuses medication and the client reason. Now, you can document this one. Pwede siyang ibutang sa doctor's order. Okay, or if the hospital has a waiver for refusal of medication administration, dito pasahinon si patient. Okay, the reason, ang time, kung saan ni-refuse, the reason for refusal, ibutang dito. And also, you provide witness, pasahinon po si witness, nga nung ning refuse ang significant others or si patient. And then, secure consent and report or inform the physician nga doc si patient kay nag-refuse ra ba siya medication after explaining to him or her unsa nga medication ihatag para asa. Okay, so nana siya ang pag-practice sa right to refuse ni patient. So no matter if we believe as healthcare professionals that we know better than the patient, we still need their permission to administer any drug. Okay, so after all, ang patient ano siya autonomy. Siya ang pinaka-importante. Siya ang pinaka-last mag-decide para sa iyahang health. You always check with the protocols of your hospital before withholding any ordered medication. Your hospital may require that the patient put his referral writing, okay, na ba sila waiver, okay, for the protection of the healthcare team and the hospital if something untoward happens as a result of refusal. So, nahitabo ni siya sa before nga refuse si patient and then we explain to the significant others din. Ang isa ka significant other, meaning ang papa sa bata is dili siya gusto i-refuse but the mother wanted to withhold or gusto niya ipastop ang medication kay tungod nag-fever ang patient. So, nahimo na noong away sa kuan. Dayon, moto, na-explainan pagtarong ang mama sa bata why the medication should be given to the child. So, napasabot rapod siya. Okay? So, if that happens, naning refuse siya, dapat ma-document sad. Okay? Mas what you did to ma-document yun pagtarong anong ning refuse. Okay? Kay, if for example, mo reklamo sila nga wala gihatag ang tambal, at least na atay proof or na evidence nga ning pirma ang pasyente nga dili sila magpahatag sa tambal. Okay? O di nila gusto ipahatag ang tambal sa ilahang uh, uh, pasyente if it's with the case of the significant others. So, check your hospital regarding the protocols in giving medications to patients who do not have autonomy. So, remember to do good and do no harm. Okay, so we have here the 11th right. We have the right response. Okay, so in practicing the right response, you reassess the patient's response. Okay, every 30 minutes. So kung naghatag kag tambal, you reassess the patient. You go to the patient, balikan kung kumusta, na by effect, wala by effect. Okay, na ba siya nabati. So different drugs may require different duration and frequency of assessment for response. Kay naay uban nga for example na IV medications nga magkinahanglan electric monitors. Okay? So you monitor the patients. Always verify the resulting change in the patient. Okay? So in order for you to verify the resulting change, dapat na kay baseline data ni patient. Okay? Mo ni ang naa sa isa sa nursing process, okay, in the case of assessment, prior to giving the medication, dapat naka-baseline data ni patient para ma-distinguish nimo if naabay kalahian or wala. Now, these changes may indicate a favorable intended response or pwedeng negative response or no change. Okay? So, dapat i-document siya and all results, okay, all results prior to giving the medication, after giving the medication, and while monitoring should be relayed. Okay, dapat i-relay sa physician or primary physician or to the physician who ordered the medication for further instructions, especially if bate ang response or there is a deterioration of vital signs or condition of the patient. Okay? Now, lastly, we have the right documentation. Okay, so this requires that the nurse immediately record the appropriate information about the drug administered. So, right documentation includes the drug, dosage, route, time, and the client's response. Okay, so make sure the right time and any remarks on the chart. Make sure that the right time and any remarks on the chart should be written correctly. Okay? So, dapat pod nabutang dito ang initial ni nurse nga nag-administer sa tambal. Okay? After giving any medication, you immediately write, okay, your initials and your signature dito sa medication sheet. Okay? Dapat kalimtan. Kay if wala gali na nambutang dinha, if it's not documented, then it is not performed. Okay. So, ano siya? If it is not documented, it means that it is not performed. Okay. So, if na-document po din ha, wala nimo gibuhat, meaning nabuhat nimo. Okay? So, inana lang ang sa documentation. So, the nursing implication in right documentation, be sure that to document the medication. Okay, and the time it was administered. So, document the site location after administering intradermal. Okay, kung asa dapita nimo gi-inject, okay, intradermally or subcutaneously or intramuscularly ang injection. Okay, dili kay kuan lang. Dito lang sa arm. Okay, pwede specify right arm, asa dapitang specific location sa right arm nimo gi-administer. Okay, you document the effectiveness of the medication within 30 minutes to 1 hour for oral medications, 20 minutes for IM, and 10 to 15 minutes for IV bolus medications. Now, ang IV bolus medications is katong diretso ka inject diretso sa imuhang IV line. Okay? So, muna siya sa IV bolus medications. So, delay in charting could result in forgetting. Okay. Kung ma-delay, okay, pwedeng malimot ka, kita chart the medication. So, again, if it is not documented, it means that it is not done. Okay. Documentation is also primary evidence, okay, for insurance companies. Okay. So, right documentation as not only a legal requirement, okay, dili lang siya legal requirement, but also a safety responsibility of the nurse. Okay. So, in case na mga reklamo-reklamo, at least na-document mo kung sa'yo nahitabo ni patient, okay, unsay gibuhat kang patient. Okay. Now, next, also in the right documentation, so everything that is medically relevant that you observe about the patient with your clinical eye before, okay, or during after drug administration must be documented. Kung unsa imong nakita before and after, okay, it must be documented and relayed to the attending physician. Okay, dapat i-monitor gid si patient. Dapat i-refer kang physician if there are any untoward incidents na nahitabo sa patient. Now, this is to ensure that there is a continuity of care. So, para pod may balo ang doctors ug ang nurses, okay, sa iyang history or course of medical treatment. Okay, kung unsa nay na undergo ni patient, okay, by following the progress of the patient's chart. Now, Naputay gitawag nga nurses' rights when administering medication. So, kung katong kaganina, those are patients' rights, kani siya mga katungod ni nurse, okay, when administering medications. Now, a right to a complete and clear order. Okay, so right ni nurse nga makadawat og complete and clear order. So if for example, eligible ang handwriting sa doctor's order, katungod na niyang mo verify sa doctor. So dili dapat masuko kung i-verify. It is also the nurse's rights to have the correct drug, route, or form, and dose dispense. Okay. So, dispense man. So, gikan ni pharmacist. Dapat insakto ang gihatag ni pharmacist nga tambal, nga form, o dose sa tambal. Okay. Now, katungod sa ni nurse nga makakuha og access to information about the drug. Okay. Now, if the nurse would ask the doctor, Doc, nganong kinahanglan man na siya ihatag ng medication sa ato ang pasyente, Doc? Okay. So, katungod na ni nurse nga mangutana. So, dapat si doctor is mutubag sad siya sa insakto nganong ihatag na siya nga medication. After all, para sa ato ang patient. Okay. So, it is also the right of the nurse to have policies to guide safe medication and administration. So, sa institutional level na niya siya. The right to administer medication safely and to identify problems in the system. Okay, so this is very important. Now, in medication administration, okay, dapat jud kang provided with PPEs, dapat provided ka with 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 gloves, okay? Kay gamiton man na siya in administering medication. Now, imo ang katungod kung mangayo ka og gloves, okay, sa hospital administrator or kung kinsa ang in charge ana niya. Okay? So, dapat providean ka sa hospital. There are some hospitals, they are not giving gloves. Okay, kaya tungod kalas lagi daw kuno, then kadaghan. So, dapat lang, kay tungod gibayaran man gud pod na ni patient ng mga gloves na gipanggamit sa hospital. So, kamahal sa ilahang bill, dili sila ma-providean og tagpila man na ang isa ka box sa gloves, tag ano man na siya, tag 250, 100 ka buok sulod. So, pwede man gud na siya i-charge sa patient after. Okay? So, it is also the right of the nurse to stop, think, and be vigilant when administering medication. So, if nagali siya'y makita nga sayop, okay, katungod niya nga, stop to nga pag-administer. Okay? Now, in preventing medication errors, okay, so dapat i-minimize kaayo ang verbal or telephone orders. Okay? Minimize verbal or telephone orders because verbal and telephone orders isa ni siya ka sa source of medication errors. Okay? So, in order for us to minimize or to prevent medication errors, dapat or pwede tang repeat the order to the prescriber to verify. Okay. You can also spell the drug name aloud. Okay. Spell the drug name aloud. Okay. Na may mga drug names nga sounds alike or looks alike ng mga tambal. So, dapat i-spell out ang pangalan para maklaro kung unsa kitang i-prescribe ni doc. You speak slowly and clearly. Okay? So, the doctor should speak, the nurse who is verifying the telephone order should speak slowly and clearly. Now, another way to prevent medication error is to list the indication next to each order. For example, butang nato dito, losartan, antihypertensive. Okay? Nguntag metformin, anti-diabetic. Okay? Ampicillin, it is antibiotic. So, kung sa indication niya, sa tong pangalan sa tambal, pwede kang magsulat sa indication after. So, avoid medical shorthand including abbreviations and acronyms kay isa po ni siya sa source nga nung magkasayop-sayop because of the use shorthands and abbreviations and acronyms. So, pwede man good siya nga, katong sa example na to kaganina, imbes nga 6 units, okay, pwede to siyang ma-interpret sa lain nga mga nurses as 60 imbes 6U. Okay? So, avoid that one. Now, we have this JCAHOS do not use list. Okay, so JCAHOS stands for Joint Commission on Accreditation of Healthcare Organizations. So this is a worldwide commission. Okay, so muna siya standard na ginagamit sa mga hospitals. Okay, so do not use U only because it may be mistaken as 0 or 4 or CC. Write the full term unit. Okay, IU, it may be mistaken as IV or 10, number 10, write the international unit. Okay, QD, okay, QOD, okay, so pwede na siyang ma-mistaken as every, okay, so write daily or every other day. Kaning mga trailing zero, okay. Okay, for example, gani, kanang mga trailing zero is kung ang order is 1 milligram, okay, for example, if your order is only 1 mg, 1 mg lang ibutang. Ayaw na pagbutang og 1.0 mg. Okay? Kaya ano, pwede manggutang masayop ani. Okay, pwede nga pagbasa nato ani 10 milligrams. Okay, nasayop ta, na-miss nato ang point. So you remove the trailing zero. Okay, that's an example of trailing zero. Dayon, for the lack of leading zero, okay, for example, kung naam gali 0.5, okay, for example, 0.5, butanin mo dito 0.5. Wait. Okay, so if it is 0.5, you write there. If the medication ordered is 0.5, okay, butang nimo da ka magbutang og 0. Okay, 0.5 milligrams. Okay, ayaw 0.5 lang. Okay, usahay basid ma-miss nimo ng point din mabasa nimo na as 5 milligrams, which is not correct. Okay, the abbreviation or the acronym MS. Okay, unsa na MS? Morphine sulfate ba or magnesium sulfate ba or medical surgical? Okay, dapat full term. Okay, you write the full term, either morphine sulfate or magnesium sulfate. We have the MgSO4. Okay, mistaken for each other, so dapat i-write ang full gyud nga term. Now we have the common abbreviations used in pharmacology. Okay, so kasagaran ani is nahumanan ni siya nga explanation sa katong isa nato ka PowerPoint or sa video explainer. So nata mag-discuss ani niya. Okay. So, one of the ways in preventing medication errors is never assume anything about items not specified in the drug order. So, example, ana, route. Dili pwede mag-assume og route. If ever walay route nga naka-indicated to, you ask the doctor or the prescribing physician. Do not hesitate to question a medication error order for any reason when in doubt. Okay? Do not hesitate to ask or to verify the medication order. Okay, so do not try to decipher words, okay, or illegible words, written orders, okay. You must verify it or contact the prescriber for any clarification. Okay, then you check the medication order and what is available using the 12 rights of medication administration. And you take time to learn the special administration technique for certain dosage forms. For example, kanang mga intrathecal route. Okay, usually ang mga inana nga mga kanang lisod kaayo nga medication administration, the doctor is the one who is administering those kinds of procedures or medications. Okay, so avoid whenever possible, use 500 milligrams instead of 0.5 grams. Okay, use 1 to 5 micrograms instead of 0.125 milligrams. Okay, so atong mga naked zeros, i-avoid pod siya. avoid pod ang trailing zeros or terminal zeros. Okay? So, you put a space between the name of the drug and then the dose. Okay, so to continue with the preventing on medication of medication errors, always listen to and honor concerns expressed by the patients regarding the medication. So, kung sa tong gibutang nila, you listen to them and then you document it and then you refer it to the physician. Kay kung naay mas nakabalo or kung naay mas nakabati sa signs and symptoms, it is the patient. Okay, the patient. Sila na ang mo reklamo, sila na ang mo complain sa kung sige bati nila. You check the patients for allergies and you check the patient's identification. Okay? So, we have the medication systems. Ang medication systems is depende sa hospital. Okay, so each facility has its own system of administering medication. So you must be familiar with this process and kung kita ay mag-change ka og hospital, pwede lahi sila nga pamaagi in providing dispensing medications in administering medications dapat ma-orient ka ana niya. So the basics of medication administration should always be observed. Okay. So, we're done with this one. For the counterfeit drugs, okay, so ang natin gitawag ng mga peke or mga counterfeit drugs. Pareha silang purma, okay? Pero, ang katong mga counterfeit drugs is pwedeng wala siya yung mga active ingredient or pwedeng wrong ang active ingredient niya or wrong amount of active ingredient. Okay? So, nana siya yung mga kalahian, okay, sa original nga drug. So, pwedeng na siya improper packaging or contamination. Okay, problems can also happen in the counterfeit drugs. Okay, so mura ra na siya pari-pariha. Okay, so you dapat i-check yun. Okay, these are some examples of counterfeit drugs like in the paracetamol, the biogesic, kay lahi sila og logo or lahi og pattern silang packaging. Okay, so this is a video nga gihatag sa FDA for us to okay, so that is an ad from the FDA. Okay, so there are some medications. Okay, so there are some medications that is to be crushed, and there is also not medications nga dili siya kinahanglan i-crush. So some medications can be crushed. You consult with your health provider kung dapat ba siya. So do not crush medications, okay? Dili dapat i-crush ang medications nga ER or extended release, okay? Your ER or your extended release medications. Gano? Those medications is dili siya para sa tiyan, but for your intestine. So, ER, extended release medications. Napot tayo gitawag nga mga SR, sustained release. Okay. Napot tayo mga tambal na gitawag og XR. XR, we have the SA, CR, MR, and XL. So these extended release and sustained release drugs, crushing will change the location and the speed of absorption. Okay, next. Take note to keep the medication supply or cart secure at all times. So, Kani siya, in the cases of wards or stations nga na ay e-cart or emergency cart, so dapat nakalock yun siya. Okay? I-open lang siya kung gamiton. Okay? And then dapat na siya'y sulod gyud. Okay? Kung sa tong nakabutang dito nga dapat content sa imuhang medication chart or medication cart, na dapat ma-follow to siya. You follow the standard precautions as appropriate, then consider legal aspects associated with drug therapy. You also consider the ethical principles when dealing with the medication errors, okay, medications during pregnancy, and investigational protocols. Okay, so you take care to avoid medication errors kay kuan na yung mga daghang tambal nga similar sounding drugs or unclear orders or wrong route of drug administration, and there is miscalculation of drug dosages. Okay, so kung sa maka-question sa medication error, kung number 1, it's illegible, difficult to read. Okay, next is we can question medication order when the drugs of the patient prescribed is questionable. So dapat may balot kung dapat para sa ang drug nga i-prescribe sa doctor. Okay, if it is you think it's inappropriate for the patient to take such drug, then you can question it. Okay, when drug incompatibilities or interactions may occur. So, asa man nato makita ang list of incompatibilities and interactions sa ato ang drug guide, drug handbook, sa MIMS, and other internet sources. So, now consider ethical problems when dealing with medication errors. Okay. You must consider ethical principles when dealing with medication errors. Okay, so these are examples of your routes of delivery. So intravenous through the vein, we have this one, intramuscular into the muscle, subcutaneous. Okay, subcutaneously, local effect, pwede siyang sa skin, topical, pwede po siya inhalation, okay, oral, rectal, sublingual, intrathecal, and transdermal.